Just gonna go ahead and just start right now. My name is Dr. Isang, and I'm a cardiologist. I use this platform to be able to talk about things regarding the heart, health, and prevention. Why? Because prevention is a lot better than treatment. Prevention is a lot less expensive in regards to each individual, in regards to each patient. So if you know what the risk factors are for heart disease and you treat that, you can prevent a heart attack from happening. You can prevent stroke from happening. You can prevent dementia. You can prevent kidney disease. And a lot of it just starts with just asking questions both to your family members, asking questions to your friends, asking questions to your doctor. Because if you're not getting the answers that you want, then you definitely want to potentially go and see a second opinion. So, what are the biggest risk factors when it comes to heart disease? What are the biggest risk factors when it comes to your health and for prevention? You have to look at things like high blood pressure or hypertension, high cholesterol, diabetes, a strong family history. If you do smoke, genetics can be a key component of it, and not just keeping up with these things, not seeing your primary care provider at least once a year to ask these questions. Am I at risk of having heart disease? And it can be as simple as just watching what your blood pressure is. It can be as simple as checking some simple labs. And if it's abnormal, start to have that discussion about things that you can do to prevent it from progressing. So if you have high cholesterol, how can we prevent the cholesterol from being higher? Because the higher the cholesterol is, especially the bad cholesterol, the more you can have plaque buildup in the arteries. And it can be in the arteries of the brain that causes a stroke, arteries in the heart that causes the heart attack, arteries in the kidneys that can lead to kidney failure, arteries in the legs that can lead to clots in the legs that can lead to leg pain whenever you're walking. So asking those simple questions, getting those lab works done, can potentially prevent the progression of these disease processes. Unfortunately, a lot of people will go to the hospital when things are really bad, and they expect that they can get back to where they were. That is true for some people, but not everybody. Not everybody's going to go back to where they were before they had heart disease. So it's important to know what these risk factors are now so that we can potentially prevent it from getting bad. It can prevent it from going downhill. One of the saddest examples I have is a patient who had a heart attack at age 20, 22, 23. And I checked labs on that individual and had very skyrocket, dangerous, almost unseen levels of cholesterol. A normal cholesterol, you typically want it to be, less than 100. This individual's, LDL, total cholesterol less than 200, but this individual's bad cholesterol was not only greater than 100, it was close to 500. And then when I asked more questions, especially family history, let me know that their parent had a heart attack at age 23, letting me know that they have a genetic predisposition to having heart disease. Unfortunately, they weren't treated for it. With lifestyle changes, watching what you're eating, controlling cholesterol, and if some individuals, they may need medical therapies to bring that cholesterol level down. And he had a heart attack. Individual had a heart attack at age 21, their mother 25. I told that individual the most important thing they can do is when they have kids to have that same discussion with their child. So that they can potentially prevent their child from having heart disease. Crazy how simple exercise and cardio is the best way to prevent, and it's ignored until it's too late. Absolutely, Sammy. And when it comes to exercise, as a cardiologist, I will always say 150 minutes of moderate intensity activity every single week. But what I care about the most is being consistent. So if you can only exercise 20 minutes, 15 minutes, even 10 minutes, if you can only exercise 10 minutes per day, you can find some amazing exercises. Type in like 10-minute EMOM dumbbell or EMOM bodyweight exercises. every minute on the minute. I get some of the best workouts with just doing that. I have a favorite one that I do is a 12-minute EMOM dumbbell kettlebell workout, because it's not every day I'm going to be able to give that full 30 to 50 minutes. So anything that you can do, whether it's 20 minutes, 10 minutes, 30 minutes, be consistent with it. Watch what you are eating, and you can see significant improvements over time with consistency and with watching what you are eating. Staying up to date in your health, asking appropriate questions, following up with your primary care provider. Hope you guys are finding any benefit in this. Any questions regarding our heart health and prevention, leave it in the comments. So what else can we do? Watching your blood pressure, watching your cholesterol, watching your blood sugar. Pavel Satchulin. I'm going to definitely have to do that because I love, if there's exercises that I can do, it is kettlebell because it is cardio and it is weights all at once. I'm writing this down, by the way. So that's the most important thing, and just stressing the importance of watching what you're eating, stressing the importance of health education, and just doing these things consistently. I'm going to be out. I'm going to be back same time tomorrow. So if you guys have any questions, random guy, I like that. I'll be back. Send me some more information about exercises that I can do too. I appreciate you guys. Listen to your bodies, listen to your health, talk to your family members, talk to your friends, talk to your doctors, nurse practitioners, PAs. Let's start now to prevent heart disease from happening. Even if you've had it in yourself, you can talk to your family members to prevent your child, your nephew from having it. All right, I'm out.